Let's see how to perform a combined first trimester screening with SsdwLab6. We introduce our user code and password to enter to the software. In the main page, it will appear several options and we choose Add Patient. The first folder of the screening that appears is Patients folder. We notice a series of edit buttons just below the tabs of the folders that allow us to save, cancel or delete. These buttons appear on all folders as we will see. In the Patients folder we must enter the data identifying the patient, surname, first name, medical historic record, or the identifier used, and date of birth that will let us calculate the age of the patient. We also can report the race, ethnicity, which can be a correction factor. And in this case the patient is Caucasian, we mark the patient as a patient test. The option Patient Test makes that all information relating to this particular patient and screening is considered by all program options as a test. So this screening will not intervene in statistical calculations or quality controls of the software. Once we save, we can go to the next folder. The following is the Pregnancy folder. We click the button Add, so we are adding a pregnancy to the patient created. In this folder we collect information concerning the pregnancy. We introduce the weight of the patient, which is a correction factor. We can report the height of the patient. The height is only mandatory in preeclampsia screening. The number of fetus, if it is a twin pregnancy. We can report the placenta type. In this case is a single fetus pregnancy. Also we can report the pregnancy type, spontaneous, in vitro fertilization, artificial insemination, transfer of frozen embryos, other. In this example we select the type of pregnancy as spontaneous. If we know, we can report the date of the last menstrual period. The next is the Screening folder. We click the Add button to add a screening to this pregnancy of this patient. We must enter the date of screening, that it's usually the same as the blood sample extraction date. We also select the screening profile. We choose a combined first trimester screening profile, which comes by default. We note that there is a section regarding correction factors and other for previous congenital anomalies. We can observe the Caucasian race is marked, as we have previously defined. The correction factors and previous congenital anomalies are 3 state boxes. When the box is a dull blue color when it is being edited, gray when we save it means not informed, not valued. The empty box means no and the box with the verification check means yes. By default these are in not valued state, unless some previous information has been reported that conditions their status. Like hormonal stimulation, which is marked as no, since it has previously been reported that the type of pregnancy is spontaneous. In this screening we mark all of them as no. Once we save, we can observe that the last 3 folders, blood test, ultrasound and risk, are created. The following is blood test folder. We enter the date of the sample which normally coincides with the date of screening. We can report the sample number and we will also enter the values of Gaussian biochemical markers that in this screening profile, combined first trimester screening, are free beta-HCG and pregnancy-associated plasma protein A. The next tab is ultrasound folder. We introduce the date of the ultrasound. If we want we can also report the ultrasound unit and the sonographer. The biometry, CRL, that will be used to compute the gestational age. We also introduce the value of nuchal translucency, which is the ultrasound Gaussian marker there is a section called fetal dichotomous markers that, in case that have been assessed by the sonographer, can be reported. They are also 3 state boxes, which by default are in the not valued state. The ones that can be assessed in the first trimester screening are the first 3 ones, which has a 1T at the end of the name of the marker. The fetal dichotomous markers, when they are reported as no, the risk decrease, and when they are reported as yes, the risk increase. And finally we come to the folder called risk. We find on the top of this folder, the computed risks: maternal age risk, trisomy 21 risk, and trisomy 18/13 risk. These are represented by colored bars. Green when the risk is low, red when the risk is high, and the risk of maternal age is always displayed in yellow. In the middle we find information about the Gaussian markers used in risk calculations. Thus we see the values of the markers, and their respective non-corrected and corrected MOMs, and the gestational age at their measurement. At the bottom of the screen there is information relating to gestational age estimation. The gestational age at the screening, blood test and ultrasound date. The expected date of delivery and the patient's age at the expected date of delivery. We also find a box that lets us enter details that will appear in the report. We have to mention that at the top, next to the computed risks, there is a frame called diagnosis that once we would know the diagnosis. If an invasive technique, amniocentesis or CVS, is performed or at the delivery time, we may introduce the diagnostic values, both trisomy 21, trisomy 18/13. It would allow us to classify the screenings in true positives, true negatives, false positives and false negatives. On the left side of the screen there is an informative summary of the patient's screening, where appear the results, risks, and MOMs, and a summary of the information introduced. We can observe the presence of a button that allows us to validate the screening. When the screening is validated, the aspect of the screen change a little. When the screening is validated, we cannot edit any data that affects the risks calculation. Also, only when the screening is validated we can generate the report. If we click the report button, a report in PDF format is generated in a new tab. The report is summary of the screening, patient details, biochemical data, ultrasound data and computed risks. Following these steps we have performed a combined first trimester screening.